Hey guys, Dr. Greg here. In this video, I'm going to show you how to balance your diaphragm. You're probably thinking, balance my diaphragm? How do I know it's even off? Well, I've been doing this now for about 6 years, and what I've found is about 90% of people have an imbalance in their diaphragm. And why is that a big deal? When your diaphragm is imbalanced, there's many things that happen inside your body. So let's jump into the details. So first off, when your body is stressed, and now you're like, oh yeah, stressed, yeah, that's me. When your body is stressed, it'll actually prioritize your left lung. And here's why. Let's talk about the lungs for a little bit. So your left lung has 2 lobes, and there's only 2 lobes because the majority of your heart takes up the space in that right lung field, left lung field rather. In your right lung field, there's actually 3 lobes. And it starts down at your diaphragm and it comes actually up above your collarbone, and obviously your heart doesn't sit inside of that. So when your body's stressed, it prioritizes your left lung field. And if I said right before, I apologize, it's your left lung field that it prioritizes. So what happens then is the right side of your diaphragm, and by the way, your diaphragm's a muscle that controls your lungs, but it also controls a lot of your digestion. And here's why. There's actually a hole in your diaphragm where your esophagus comes down through. And if that muscle, it doesn't have the right tone or the right neurology, your body will actually back off some of the digestive components, because people can get things like acid reflux or GERD. Some people might even call it a hiatal hernia. Now, so what happens is the right side gets lazy, for lack of better terms. Now, this is what it could mean from like a musculoskeletal standpoint. So they did in a cadaver lab, they found that there's a fascial plane. And that fascial plane starts in the left hip, it comes up the side, comes across the diaphragm, and into the right neck and shoulder. So even if you have hip stuff, or like maybe that area between your shoulder blades, or right neck and shoulder stuff, it could actually be your diaphragm being imbalanced that causes that torsion in your body. Now, from more of a functional medicine standpoint, if the right side of your diaphragm doesn't do what it's supposed to do, remember your liver and your stomach sit right up against the right side of that diaphragm. So if the diaphragm's not moving the way that it's supposed to, the liver doesn't get that movement from the diaphragm to help it pump, dump, and detox. Okay, so in this video, I'm actually going to walk through the steps so that I can teach you how to do this by yourself. So the idea is we're going to focus on the right side of the lung field and allow it to kind of get its message going again. So the first thing we're going to do, there's a 3-step acronym that I use. So the first one is TIP, and I'll show you kind of vertically. So TIP, this is my left side. So you essentially take your entire side and you tip to the left. And why we're doing that, when we do this very specific breath work, we're actually going to try to make this left side tight so that we can open up the right side. So the first step is tip. The second step is tight. So when we tip off to the left, we want to make these muscles on our left side as tight as we can, so that we can, again, open up that right side. And the third step is breathe. The breath work inside of this diaphragm work is very important. When you do the work, you're going to be taking the breath in through your nose, and then when you breathe out, you're going to breathe out like you're breathing through a straw with your mouth. So the breath in, and we breathe out, it's... And what I need to tell you about the breath out, that's where the magic is inside of this. The goal of resetting the diaphragm is letting out as much air as you possibly can. And I need to tell you this, there's more breath in your lung than you think. Because think about it, when you breathe out, your diaphragm goes up. Think of your diaphragm as like wringing out your lung. So when you breathe out, that diaphragm goes up, 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 up. So the magic is in how long you can breathe out. Okay, so I'm going to demonstrate this, and we're going to walk through those 3 steps so that you can do this by yourself. Now, what I would recommend if you've never done this before is I would recommend that you do this twice a day. The 2 most important times of the day to do this are right when you wake up and right before you go to bed. And it's simply just, those are times that we can remember. But what you're going to learn is you can kind of do it anywhere. You don't have to be laying down. You can be standing. You can be sitting. And what I need to tell you is I have seen nothing short of miracles with this. For myself, I had a hip issue from lifting weights. completely cleared up with this. My daughter had a right shoulder injury from lifting weights, completely cleared up. We had a young woman that showed up into our practice with excruciating acid reflux and heartburn. She was going to the urgent care every 10 days, and literally after one session, she was like, it's gone. We have people that have mid-back tightness and those types of things. So we've seen some amazing things with this, and it costs absolutely nothing, so you have nothing to lose. All right, so I'm with Miss Grace here. I'm gonna walk through the steps of this so that you can do this exactly on your own. Are you ready? All right, so the first thing we're gonna do, remember, is the tip. So if you're laying down, you're gonna drop your left shoulder. So bring your left shoulder down. And what a lot of people like to do with their head is they like to do this. Okay, that's not tipping. So you keep your head in a neutral spot. So if Grace did this, I'd be like, that's the wrong thing. So keep your head in a neutral spot. Make sure your feet are flat. So that's the tip. So she's tipped off to her left. So step number one is good. Number two is tight. So what I would say, Grace, is take your left hand and put it just under like above your hip. So like a personal trainer, what I want you to do now, Grace, with these muscles on your left side is take your side and push your left hand down into the table. So with your muscles, compress down so you can feel yourself pushing into the table. So that's the tight portion, okay? And sometimes you can even like touch like on your abdomen, kind of like a trainer would, like make this tight, okay? Now, it's almost impossible to keep the right side perfectly loose while the left side is tight, but do your very best. Another tip inside of the tight portion is make sure your right shoulder is relaxed. So many times people's right shoulders are like tight and tense because remember, there's that fascial plane that goes up into that right shoulder. So make sure your hips are just relaxed, and especially the right shoulder is relaxed. Okay, so we've got tip, we've got tight, and now we're gonna do 3 cycles of the breath. So go ahead, big breath in through your nose, and all the way out. Now, so you have to keep the tension throughout the entire thing. The toughest part to keep the tension is when you want to take that breath in again. So make sure you're keeping that tension. And I need you to breathe out until you almost feel like you're gonna pass out, because the idea is we're gonna be pushing that right diaphragm up as high as possible. And go ahead and do one more. Keep that tension. Ooh, look at you. And what you'll find, by the way, is you'll actually notice that each breath you take, you're gonna be like, oh my gosh, I feel like I have more air in my body. And you're exactly right. What you're actually doing is you're allowing your right side to open up more fully. So, tip, tight, breathe, and here's why this is important. Good job, Grace, you can chill. Here's why this is important. We know that if your nervous system is stressed, if your respiratory system or your digestive system is stressed, you're not going to heal. Many of you have heard of breath work, right? And I love breath work, whether it be box breathing or Wim Hof breath work or this diaphragmatic breath work. What we know is it's one of the most amazing ways for your nervous system to move into a state where it can actually say, it's okay for me to heal. You've heard of the term sympathetic and parasympathetic, fight or flight versus rest or digest. So breath work, respectfully, has some of the very best research when it comes to your overall healing. So tip, tight, breathe. Let us know how it went.